Hi, today I'm going to be sharing with you my top 3 exercises for the relief of pain from an L4-5, L5S1 disc bulge. I'm also going to explain to you what a disc bulge is so you can understand what the pain is all about. Also, remember to watch to the end because I'm also going to share 2 simple strategies that you can use that will help you with activities that you do every day. Hi guys, my name is Dr. Shelley Bhullar. I'm a chiropractor. I'm based out of Brampton, Ontario, Canada. I have over 20 years of clinical experience helping hundreds of people with spine-related conditions such as the L4-5, L5S1 disc bulge. We use chiropractic techniques, non-surgical spinal decompression, and tips and strategies similar to what we're sharing today. Remember to watch to the end so that you don't miss anything that we're going to be sharing with you today. Also, if you would, please click the button below to subscribe to our channel. I'm looking forward to bringing you tips and strategies that will help you to get your health back and also to make sure that you can get back to doing the things that you want to do and love to do. So let's understand what's happening at the spinal level. So here we have a normal segment from our spine. We'll see that we have these two vertebrae here, or the bones. We have a disc, 2 discs here. We have these nerves that come out from every level. So we have the spinal cord that runs the length of the spine. It starts from the base of the skull, and then it runs the length of the spine all the way down. And so what we're looking at when we look at the top here, we're looking at the disc itself. So you'll notice that it's nice tight layers. It's almost like an onion, right? So it's nice tight compact layers. And what happens is that as we go through life, and it could be either several smaller traumas, or it could be one big trauma. What can happen is that the layers, they actually weaken, and as they weaken, the material from inside can actually start to push out. So looking at it from this final segment here, we can see that we have the same disc, the two bones, and it's healthy disc, nice and compressed. It's going to move. It's going to allow us to flex, move, do all the mobility things that we need to do. But what happens is that when the outer rings are getting weaker, then that material can actually push out. And what happens is it's going to push out like this, and then it's going to hit that nerve. And when it hits that nerve, then we can have that discomfort or pain that we experience. So that experience can be the lower back pain that we feel. It can be the pain that goes into our buttock, down the legs, right to our toes. So what we want to do is we want to make sure that we can do anything that can help to relieve that pressure or on pressure or the stress on that nerve. So we're going to talk about what those exercises are. I'm going to explain each exercise. I'm going to explain the benefits of it, and we'll go through them one at a time. So the first exercise that we're going to start with is the posterior pelvic tilt. Now, the posterior pelvic tilt is a very gentle exercise that we can do that can gently just help us to gap some of those discs and decompress that spine to help relieve some of the discomfort that we experience. So what you're going to do for this is you're going to lie down like this, face up. You're going to bend your knees, keep your feet flat on the ground. And then what you're going to do is imagine that you're going to turn your pelvis and flatten your back against the floor. So what you can do is initially first, just if you reach underneath, you'll feel that there's a little bit of a gap in there, so a space. And if you want to, you can even keep your hand there. And what we're going to do is just tighten our abs and then just gently push back and flatten our back against the floor. We're going to hold that for about 3 to 5 seconds, and then just relax. And then we're going to do that again, pushing back, holding for 3 to 5 seconds, just whatever feels comfortable. We don't want there to be any discomfort or pain. And then you can even take your hand out, and then again, just tightening the core and pushing down, and then just relaxing. And we're going to repeat that for 3 sets of 10. Now, the next exercise that we're going to do is called the cow cat. And so essentially we're going to be on all fours. Your hands or your arms are right directly under your shoulders. Your knees are about hip width apart. And what we're going to do here is we're going to take a nice big deep breath in. And as we breathe in, we're going to roll our shoulders up. So nice deep breath in. And then we're going to exhale and then bring our stomach down and look up. So essentially what's happening is imagine that there's a string at the back between your rib cage, and that string is being pulled up, up, up. That's going to pull your upper back up. And now imagine there is a string tied to your belly button, and that string is pulling your belly button down, down, and down. The other thing that you can do is you can actually do it seated too. So if you do have a challenging time getting on all fours, what you can do is just sit at on the edge of your chair. And what you a similar thing that what we do, we're gonna just put your hands on top of your knees, and then we can bend our upper back. So imagine there's a cable pulling my upper back towards the wall. And now as I come back, now again, that belly button has a string that's pulling me forward. And I can just slowly rock back and forth. And the other thing that we want to remember when we're doing these stretches is whatever, if you get into too much of an extension into the lower back and you start feeling discomfort, you want to ease off on that. So all of these things that we're doing, all of these stretches and exercises that I'm showing you today, we want to only do them to where we're feeling okay. We don't want to do them into pain. So the next exercise that we're going to do is called the Sphinx pose. It's part of the McKenzie protocol that we might have heard of before. So what we're going to do here is we're going to start off with ourselves lying face down, and we're going to just gently come up onto our elbows and just stay here for a couple of nice deep breaths. We can actually stay here for a few seconds, and as we start feeling that it feels better, so what we're looking for is what we call centralization of pain. So if you're having pain that's going down the leg or into the buttock, as you're in this position, what happens is as we're reducing the pressure on the disc itself, we're actually getting that pain to centralize, so it's not going down the leg anymore, and now it's localizing more to the lower back. So again, you can stay in this position, you can stay here for 30 seconds, and you can even use this exercise throughout the day a few times over the course of the day as well, and even go up to even about 15 minutes if that feels comfortable. And so you're going to just slowly come down. And so if you're doing it short spurts, if you're doing only 15 to 30 seconds, and then you can come back up again and then hold that position there again. And then probably good thing to do would be 3 sets of 10 on this one in that pose. But again, if you find it comfortable and you want to do it for longer, you can even do that. And that same exercise, another modification for it could be if you're having a challenging time, again, lying down on the floor, you can place your hands behind your back and then just gently arc back to what feels comfortable, hold it there, and then gently come back up into a straight position. And now, like I promised, we're going to share with you those 2 tips as well to get you through the day with the activities that you have to do every day. One of them is sitting and then getting out of that sitting position. So the important thing is to always to make, when you're sitting, to make sure that you're sitting in a nice, stable, supportive chair. You don't want to be sitting in something that's soft and cushy because that doesn't provide any support. So when you sit in a stable chair, then you have that support. You can always even use a backrest as well. That can also help in terms of discomfort or pain as well. And sometimes even rolling up a towel if you don't have a back support or anything and wedging it down in this area, that can also help to provide you with that little bit of extension in your back that can help to relieve some of the pain. So now when we're getting out of a sitting position and when we're going to a standing position, that can also end up creating a lot of discomfort or pain too. So one of the really cool things that we can do to just help reduce that is come to the edge of our chair. So normally what we do when we're getting out of the chair, we do this, and notice how when we flex, that's going to put load on that and back, and then that's going to cause some of that discomfort or pain that we experience. So if we come to the edge of our chair, so slowly, however you need to do it, if you gotta just kind of wiggle yourself close to the edge, we're going to come to the edge, and then we're going to use our hands on our knees or hands on our chair, and we're going to use our legs to help us come up. So what you want to do is take a nice deep breath in, tighten that your abs up against the spine to support that, and then you're going to take a nice big deep breath in, and on the exhale, using your legs and your arms, you're going to stand up, and that's going to take a big load off of the lower back and help to reduce the stress on that L4-5, L5S1 disc bulge. And the second tip that I'm going to share with you today is when we're brushing our teeth or washing dishes, many patients complain about having that lower back pain get worse while they're doing those activities. So a very simple thing that we can do is just elevate one foot or the other and alternate that as you need to in order to help reduce some of that pressure as well. So when we're brushing our teeth, we're standing over our sink, or we're standing over our sink to wash those dishes as well. Again, in that flex position, creating that pressure, creating that pain. So what we do is we just open our cupboard and we can place one foot up, and now I have a much stronger base here. It's going to put less pressure on my lower back. And now I can brush my teeth. I can even bend forward, but now I'm not really bending forward. I'm almost hinging here. And that's also going to reduce the pressure on the lower back and again, help you to relieve some of the pain. Now you can do this anywhere you need to. All you need is a box, or I'm going to date myself if you remember the yellow pages. So something about that thick. You can place it on the floor and again, just raise that one leg at a time to give yourself some break from having your one leg up the whole time. And that will also help to reduce the pressure or stress in the lower back and also help to reduce the pain from that L4-5S1 disc bulge. Now, if you found this information helpful, if you know somebody who is experiencing an L4-5S1 disc bulge, please like and share this video with anyone that you can. We're looking forward to sharing more tips and strategies with you. So please make sure you hit that subscribe button. We look forward to helping you soon.